Turmeric. Turmeric, a plant in the ginger family, is native to Southeast Asia and is grown commercially in that region, primarily in India. Its rhizome, underground stem, is used as a culinary spice and traditional medicine. Turmeric, Curcuma longa, has been used for 4,000 years to treat a variety of conditions. Historically, turmeric was used in Ayurveda and other traditional Indian medical systems, as well as Eastern Asian medical systems such as traditional Chinese medicine. In India, it was traditionally used for disorders of the skin, upper respiratory tract, joints, and digestive system. Turmeric is promoted as a dietary supplement for a variety of conditions. That includes arthritis, digestive disorders, respiratory infections, allergies, liver disease, depression, and many others. Turmeric is a common spice and a major ingredient in curry powder. Curcumin is a major component of turmeric. The activities of turmeric are commonly attributed to curcuminoids, curcumin and closely related substances. Curcumin gives turmeric its yellow color. Turmeric dietary supplements are made from the dried rhizome and typically contain a mixture of curcuminoids. Turmeric is also made into a paste for skin conditions. Much research has been done on substances from turmeric, but their health effects remain uncertain. Turmeric and curcumin have a variety of interesting biological activities. They're challenging to study because curcumin is unstable, it easily changes into other substances. It has low bioavailability, not much of it reaches the bloodstream when it's taken orally. Curcumin products may differ in composition or contain more substances than expected. It makes the results of research on these products difficult to understand and compare. The actions of turmeric and its components in people are complex and not well understood. No clear conclusions have been reached about whether these substances have benefits for health conditions. Turmeric is a widely used herbal product derived from the roots of Curcuma longa, plant belonging to the ginger family. It contains a chemical called curcumin, which might reduce swelling. Curcumin gives turmeric that yellowish color, but it stains easily. Turmeric has a warm, bitter taste and is frequently used to flavor or color curry powders, mustards, butters, and cheeses. Curcumin and other chemicals in turmeric might decrease swelling. It is often used to treat conditions that involve pain and inflammation. It is advertised as dietary supplement for a variety of conditions, arthritis, respiratory infections, liver disease, aging, and prevention of COVID-19. Other names: curcuma, curcuma aromatica, curcuma domesticum, curcuma longa, curcuma longae rhizoma. Curcumin, curcumin, curcuminoid, curcuminoid, curcuminoids. Curcuminoids: halata, haldi, haridra, Indian saffron, Nisha, Pianjang huang, Racinda curcuma, Radix curcumae. Rajani, Rhizoma cucurmi longae, saffron bourbon, saffron de batrolida, saffron de onda, turmeric root, Eugene. Plant description. A relative of ginger, turmeric is a perennial plant that grows 5 to 6 feet high in the tropical regions of southern Asia, with trumpet-shaped, dull yellow flowers. Its roots are bulbs that also produce rhizomes, which then produce stems and roots for new plants. Turmeric is fragrant and has a bitter, somewhat sharp taste. Although it grows in many tropical locations, the majority of turmeric is grown in India, where it is used as a main ingredient in curry. Parts used: the roots, or rhizomes and bulbs, are used in medicine and food. They are generally boiled and then dried, turning into the familiar yellow powder. Curcumin, the active ingredient, has antioxidant properties. Other substances in this herb have antioxidant properties as well. Available forms: turmeric is available in the following forms: capsules containing powder, fluid extract, tincture. Bromelain increases the absorption and anti-inflammatory effects of curcumin, so it is often combined with turmeric products. The trials of turmeric in humans have not shown toxic effects. Turmeric is a key ingredient in curry powder and also has a long history of use in Ayurvedic medicine. The active ingredient is curcumin, which has been found to reduce inflammation and increase antioxidants. There has been some research into whether these properties could protect against heart disease or improve outcomes for people with coronary heart disease. However, Although studies have had some positive results, these have not been consistent. In some cases they have been small, short in duration or based on animals, not humans, which makes it difficult to draw reliable conclusions. The issue is complicated by the fact that the curcumin in turmeric is not easily absorbed by the body, so you may get little or no benefit. Therefore, in general, turmeric supplements are not recommended. Turmeric supplements are safe for most people. But if you're taking anticoagulants, blood thinners, such as warfarin, check with your doctor before taking turmeric supplements. High doses of turmeric could have a blood thinning effect. If taken on top of prescribed anticoagulants, this could increase the risk of dangerous bleeding. People with liver or bile duct problems should not take turmeric supplements, as they can increase bile production. Cooking with turmeric shouldn't cause problems. But don't assume that foods and drinks, such as turmeric lattes, which use turmeric as a selling point, are healthy. They often come with added ingredients that are high in saturated fat or sugar. Turmeric health benefits. The spice, which is easy to add to smoothies and curries, shows promise when it comes to the following health benefits. Lessens inflammation. For chronic conditions where inflammation starts to affect tissues in your body, taking turmeric may be beneficial. In one study of patients with ulcerative colitis, those who took 2 grams of curcumin a day along with prescription medication were more likely to stay in remission than those who took the medicine alone. It won't necessarily help during an active flare-up, but it may help prolong remission. Improves memory. Another clinical trial showed that 90 mg of curcumin taken twice a day for 18 months helped improve memory performance in adults without dementia. Researchers thought that the reduction in brain inflammation and curcumin's antioxidant properties led to fewer declines in neurocognition, which is the ability to think and reason. Curcumin may also have a role in preventing the development of Alzheimer's disease, however, that's an area where we need more research. Lessens pain. Turmeric has also deep roots in both Chinese traditional medicine and Ayurveda for treating arthritis. Research suggests that taking turmeric extract could potentially reduce pain from osteoarthritis, though further study is still needed. But do not rely on a curcumin supplement alone. Medical management should come first. Fights free radicals. Turmeric has antioxidant properties and one study shows that it may protect your body from free radicals by neutralizing them. Another study suggests that turmeric's antioxidant effects may also stimulate the action of other antioxidants. Lowers risk of heart disease. With its ability to help reduce inflammation and oxidation, turmeric could lower the risk of heart disease. Studies show that turmeric may help reverse the heart disease process. In healthy middle-aged and older adults who took curcumin supplements for 12 weeks, resistance artery endothelial production, which plays a significant role in high blood pressure, was increased. Another study followed 121 people who had coronary artery bypass surgery. A few days before and after the surgery, the group that took 4 grams of curcumin a day saw a 65% decreased risk of having a heart attack in the hospital. Turmeric also may be helpful when used along with medication for managing cholesterol levels. Research shows that curcumin is safe and may protect those at risk for heart disease by lowering certain levels of cholesterol. Though more study is needed to look at how much and what type is effective. Helps fight depression. If you have depression, the protein known as brain-derived neurotrophic factor, BDNF, is reduced, and your hippocampus, which helps with learning and memory, starts to shrink. A study shows that curcumin can boost BDNF levels and may reverse changes. Another study shows that curcumin was just as effective as fluoxetine, Prozac, in lessening symptoms of depression. Curcumin may also increase levels of serotonin and dopamine, which are chemicals in your brain that regulate mood and other body functions. Helps prevent cancer. Curcumin may affect cancer growth and development according to a few studies. One study, which focused on colorectal cancer, saw a 40% reduction of the number of lesions in the colon in men. Nutritional value. While doctors commonly recommend taking 500 mg twice daily with food, the dose that's right for you depends on your overall health. More isn't always better, so talk to your doctor. It's safe to take up to 8 grams per day, but my recommendation would be somewhere on the lighter side. 500 to 1000 milligrams a day for the general population. For optimal absorption, try taking with heart-healthy fats like oils, avocado, nuts and seeds. While the risk of side effects is low and drug interactions are unlikely, stop taking turmeric if you notice ill effects. Turmeric may cause bloating, and there is a theoretical concern that it may interact with blood clotting medications. Also avoid it if you have gallbladder disease. Always talk to your doctor before starting a dietary supplement, since they could potentially interact with other medications you're taking. Turmeric can help supplement your conventional care, but it's not a substitute for medicine. When taken by mouth, turmeric is likely safe when used short-term. Turmeric products that provide up to 8 grams of curcumin daily seem to be safe when used for up to 2 months. Also, taking up to 3 grams of turmeric daily seems to be safe when used for up to 3 months. Turmeric usually doesn't cause serious side effects. Some people can experience mild side effects such as stomach upset, nausea, dizziness, or diarrhea. These side effects are more common at higher doses. When applied to the skin, turmeric is likely safe. It is possibly safe when turmeric is applied inside the mouth as a mouthwash. When applied into the rectum, turmeric is possibly safe when used as an enema. Special precautions and warnings. When taken by mouth, turmeric is likely safe when used short-term. Turmeric products that provide up to 8 grams of curcumin daily seem to be safe when used for up to 2 months. Also, taking up to 3 grams of turmeric daily seems to be safe when used for up to 3 months. Turmeric usually doesn't cause serious side effects. Some people can experience mild side effects such as stomach upset, nausea, dizziness, or diarrhea. These side effects are more common at higher doses. When applied to the skin, turmeric is likely safe. It is possibly safe when turmeric is applied inside the mouth as a mouthwash. When applied into the rectum, turmeric is possibly safe when used as an enema. Pregnancy. Turmeric is commonly used in small amounts as a spice in foods. But it's likely unsafe to use larger amounts of turmeric as a medicine during pregnancy. It might cause a menstrual period or stimulate the uterus, putting the pregnancy at risk. Do not take medicinal amounts of turmeric if you are pregnant. Breastfeeding. Turmeric is commonly used in small amounts as a spice in foods. But there isn't enough reliable information to know if turmeric is safe to use in medicinal amounts during breastfeeding. Stay on the safe side and avoid use. Gallbladder problems. Turmeric can make gallbladder problems worse. Do not use turmeric if you have gallstones or a bile duct obstruction. Bleeding problems. Taking turmeric might slow blood clotting. This might increase the risk of bruising and bleeding in people with bleeding disorders. Hormone-sensitive conditions such as breast cancer, uterine cancer, ovarian cancer, endometriosis, or uterine fibroids. Turmeric contains a chemical called curcumin, which might act like the hormone estrogen. In theory, this might have effects on hormone-sensitive conditions. Until more is known, use cautiously if you have a condition that might be made worse by exposure to hormones. Infertility. Turmeric might lower testosterone levels and decrease sperm movement. This might reduce fertility. Turmeric should be used cautiously by people trying to have a baby. Liver disease. There is some concern that turmeric can damage the liver, especially in people who have liver disease. Don't use turmeric if you have liver problems. Surgery. Turmeric might slow blood clotting. It might cause extra bleeding during and after surgery. Stop using turmeric at least 2 weeks before a scheduled surgery. Interactions. Moderate interaction. Be cautious with this combination. Medications that slow blood clotting, anticoagulant or antiplatelet drugs, interacts with turmeric. Turmeric might slow blood clotting. Taking turmeric along with medications that also slow blood clotting might increase the risk of bruising and bleeding. Medications for diabetes, anti-diabetic drugs, interacts with turmeric. Turmeric might lower blood sugar levels. Taking turmeric along with diabetes medications might cause blood sugar to drop too low. Monitor your blood sugar closely. Talinolol interacts with turmeric. Turmeric might decrease how much talinolol the body absorbs. Taking turmeric while taking talinolol might decrease the effects of talinolol. Sulfasalazine, azulfidine, interacts with turmeric. Turmeric might increase how much sulfasalazine the body absorbs. Taking turmeric while taking sulfasalazine might increase the effects and side effects of sulfasalazine. Tacrolimus, Prograf, interacts with turmeric. Warfarin, Coumadin, interacts with turmeric. Warfarin is used to slow blood clotting. Taking turmeric while taking warfarin might increase the effects of warfarin and increase the risk of bleeding and bruising. Medications for cancer, alkylating agents, interacts with turmeric. Turmeric is an antioxidant. There is some concern that antioxidants might decrease the effects of some medications used for cancer. If you are taking medications for cancer, check with your healthcare provider before taking turmeric. Medications for cancer, anti-tumor antibiotics, interacts with turmeric. Turmeric is an antioxidant. There is some concern that antioxidants might decrease the effects of medications used for cancer. If you are taking medications for cancer, check with your healthcare provider before taking turmeric. Medications for cancer, topoisomerase I inhibitors, interacts with turmeric. There is some concern that antioxidants might decrease the effectiveness of some medications used for cancers. If you are taking medications for cancer, check with your healthcare provider before taking turmeric. Amlodipine, Norvasc, interacts with turmeric. Turmeric might increase how much amlodipine the body absorbs. Taking turmeric while taking amlodipine might increase the effects and side effects of amlodipine. Medications that can harm the liver, hepatotoxic drugs, interacts with turmeric. Turmeric might harm the liver. Some medications can also harm the liver. Taking turmeric along with the medication that can harm the liver might increase the risk of liver damage. Tamoxifen, Nolvadex, interacts with turmeric. Turmeric might decrease how much tamoxifen is in the body. Taking turmeric with tamoxifen might decrease the effects of tamoxifen. Minor interaction. Be watchful with this combination. Medications changed by the liver, cytochrome P451A1, CYP1A1, substrates, interacts with turmeric. Some medications are changed and broken down by the liver. Turmeric might change how quickly the liver breaks down these medications. This could change the effects and side effects of these medications. Medications changed by the liver, cytochrome P451A2, CYP1A2, substrates, interacts with turmeric. Some medications are changed and broken down by the liver. Turmeric might change how quickly the liver breaks down these medications. This could change the effects and side effects of these medications. Medications changed by the liver, cytochrome P453A4, CYP3A4, substrates, interacts with turmeric. Some medications are changed and broken down by the liver. Turmeric might change how quickly the liver breaks down these medications. Estrogens interacts with turmeric. Large amounts of turmeric might interfere with the effects of estrogen. Taking turmeric along with estrogen might decrease the effects of estrogens. Some estrogen pills include conjugated equine estrogens, Premarin, ethinylestradiol, estradiol, and others. Norfloxacin, Noroxen, interacts with turmeric. Turmeric might increase how much norfloxacin the body absorbs. Taking turmeric while taking norfloxacin might increase the effects and side effects of norfloxacin. Medications moved by pumps in cells, P-glycoprotein substrates, interacts with turmeric. Some medications are moved in and out of cells by pumps. Turmeric might change how these pumps work and change how much medication stays in the body. In some cases, this might change the effects and side effects of a medication. Paclitaxel, Abraxane, Unxol, interacts with turmeric. Turmeric might change how much paclitaxel stays in the body. Taking turmeric while taking paclitaxel might change the effects and side effects of paclitaxel. However, this doesn't seem to be a big concern. Docetaxel, Docetaxel interacts with turmeric. Turmeric might increase how much docetaxel the body absorbs. Taking turmeric while taking docetaxel might increase the effects and side effects of docetaxel. Glyburide, diabeta, others, interacts with turmeric. Turmeric contains curcumin. Curcumin might lower blood sugar. Glyburide is also used to lower blood sugar. Taking curcumin or turmeric along with glyburide might cause your blood sugar to go too low. Monitor your blood sugar closely. Your dose of glyburide might need to be changed. Drugs that reduce stomach acid. Turmeric may interfere with the action of these drugs, increasing the production of stomach acid. Cimetidine, Tagamet, famotidine, Pepcid, ranitidine, Zantac, esomeprazole, Nexium, omeprazole, Prilosec, lansoprazole, Prevacid. Curcumin is reported to be safe orally at the dose of 6 grams per day for 4 to 7 weeks. But one reason for its safety is that it's poorly absorbed orally. Marketed turmeric supplements include black pepper, which highly increases its absorption. 20 milligrams of piperine can increase turmeric absorption by 20-fold. This enhanced absorption leads to severe liver injury. In this study by the U.S. Dillon Group, authors found 10 cases of turmeric-associated liver injury, and of them were women. Liver injury associated with turmeric, a growing problem, 10 cases from the Drug-Induced Liver Injury Network, Dillon. Background of the study. Results of the study. 10 cases of turmeric-associated liver injury were found, all enrolled since 2011 and 6 since 2017. Of the 10 cases, 8 were women, 9 wide and median age 56 years, range 35 to 71. Liver injury was hepatocellular in 9 patients and mixed in 1. Liver biopsies in 4 patients showed acute hepatitis or mixed cholestatic hepatic injury with eosinophils. 5 patients were hospitalized, and 1 patient died of acute liver failure. Chemical analysis confirmed the presence of turmeric in all 7 products tested. 3 also contained piperine, black pepper. Conclusion of the study. Liver injury due to turmeric appears to be increasing in the United States, perhaps reflecting usage patterns or increased combination with black pepper. Turmeric causes potentially severe liver injury that is typically hepatocellular, with a latency of 1 to 4 months and strong linkage to HLA-B 3501. One reason given for its safety is that curcumin is poorly absorbed orally. Indeed, it is unclear whether there is adequate systemic exposure to achieve any of the purported beneficial or adverse effects of oral turmeric or curcumin. However, recently marketed turmeric supplements often include piperine, black pepper, which can dramatically increases its systemic bioavailability. For example, only 20 milligrams of piperine taken with turmeric is reported to increase its bioavailability 20-fold in serum. Conceivably, the enhanced bioavailability could potentiate liver injury. Results of the study. A total of 2,392 cases of suspected drug-induced liver injury were enrolled in the Dillon prospective study between September 2004 and March 2022. Of this total, 2,278 had undergone formal adjudication for causality and 1,798 were scored as definite, highly likely or probable, high confidence. Of the high confidence cases, 345, 19%, were attributed to an herbal and dietary supplement, 3%, of which were attributed to turmeric. All turmeric cases were enrolled during or after 2011, and 6 since. The experience in Dillon reported here with turmeric-associated liver injury suggests that this phenomenon may be increasing in the United States, at least since 2017. Additionally, a reliable description of the clinical presentation, laboratory features, liver histology and outcomes of turmeric-associated liver injury are provided from these prospectively enrolled and well-characterized cases. Of note, no other drug or herbal and dietary supplement product was implicated in these cases. Clinical significance. Turmeric is a widely used herbal product promoted as a dietary supplement for a variety of conditions. Liver injury due to turmeric appears to be increasing, reflecting usage patterns and combination with black pepper, which increases its absorption. The pattern of turmeric-related liver injury is typically hepatocellular, with a latency of 1 to 4 months and linkage to HLA-B3501.